And there were some next steps that the COG will be following up on, including touching base with the cities as well as the local service providers to ensure maximal alignment, as well as concrete deliverables that the COG envisions as a result of innovation funding. But I think other than that, I don't have any updates because I know that a lot of you guys have a lot of questions in regards to the project room key. May I open it to the group to see if they have any questions on homeless initiative efforts in general or the items that I just spoke on?
Yeah, absolutely. So if anybody has a question, a general question right now for Ashley, just raise your hand using the icon, and then I will call on you and you can pose your question. All right, I'm not seeing any questions right now, Ashley. So if you want, why don't we ask Jose to unmute himself, and then maybe you guys can do the update on Project Room Key, and then we'll see if there's any questions that pop up for you guys at that point.
That would be great. Also, I did send a video to Grace so that we could tee up for this presentation. Jose, would it be okay if Grace shares a brief video in regards to Project Room Key?
I am but a visitor in this establishment, so if that is the order of the group, move forward.
Okay, Grace, you want to share your
Thank
screen?
you.
Okay.
Yeah, actually, David's going to be sharing the video because we've been practicing all afternoon, it seems, and I was having problems. So, David, do you have that video ready to go?
Okay, looks like he's already started.
To have a place to reside that's dignified, so that the roof over their head, the door through which they walk, the surroundings in which they find themselves, honors their sense of personhood and self-worth. And that's what's happening here. We never housed this many people this quickly, ever.
Some people are like, we didn't even know you're here, but we've been here for 40 years. The project with Room Key has been surpassed our expectations. We have been fully supported at every level. We were able to offer positions to all of our staff, and it's been a rebirth. The economic impact for anyone in the hospitality industry is devastating. Probably right now, 90% of all hotels throughout Los Angeles are closed. This is an opportunity to not only get our workforce back, but to give new life to our rooms, to facilitate staying here for our new guests. It's just been a win-win.
It's nice, really nice. I was iffy about it. I was, doing real bad on the street, and I looked at him and I told him, "Do you want to go and check it out?" He said, "Yeah." So, I mean, honestly, my probably advice would be just give the programs a chance. I'd probably say wonderful, a wonderful experience.
Peaceful.
Because this is an opportunity where we can make a difference. It's about public health. It's about the dignity of the individuals who are yet homeless. And it's about making progress so that we can demonstrate that we can, in fact, reduce in a substantial way the homeless crisis in our county.
Okay, Jose or Ashley, you want to?
Ash, do you want to kick it off?
I will. Thank you. So thank you for sharing that video, and Dr. Shika, thank you so much for advising me that video existed. So could we go to the first slide? Actually, the second slide.
And,
should I just go, Grace? Do people see it?
No, it's not. It's not up yet. David,
Okay.
Are you going to load up the slide for Ashley as well?
Yep, I'm pulling it up right now.
Okay.
I have to say, Grace has the coolest backdrop.
My head's floating in the Pacific Ocean. Catalina in the background.
So I think the presentation's still booting up.
Yeah, let me see if
Ash, maybe you can just go with the first slide is just sort of general overview and just sort of what we intend to do for the presentation. Oh, there you go.
Are you guys able to see it?
Only first, third, top. I'm more than happy to start as David triages. So pretty much, again, thanks for having Jose and I to brief you on a very important regional project that's taking place right now. For this presentation, we would like to cover 6 key areas. One is just an overview of the program, Project Room Key, and then the goals to the Project Room Key, and I'll start using the acronym PRK. And then Jose will take a deeper dive in terms of the participants at the PRK sites, as well as the process and the goals of securing hotel-motel leases, and then the number of rooms, right? And then also the operation of PRK sites, including the referral process, and of course the exit strategy, because certainly it is our hope that we will be able to move forward as we hopefully enter into the recovery phase sooner or later. So on that note, if you could move to the second slide. I think you may have to press a couple more buttons so that they're...
Are you guys oops, let's see.
No, next page.
Are you guys able to see it?
I'm on...
Yes.
Okay.
Next slide. Yes, we can see it.
Okay.
Next slide. There we go. Just in a nutshell, Project Room Key is a collaborative effort by the California State, County, and LASA to secure hotel-motel rooms for the vulnerable people experiencing homelessness. And Jose will go into what defines them as vulnerable. But at the end of the day, it's a vulnerable population. If they were to be infected with the disease, they have the highest likelihood of being hospitalized or dying. There are this tri-entity collaboration really involves leasing up to be able to stand up these Project Room Key sites as fast as possible, as well as the service providers, because we want to make sure that this is an opportunity to not only shelter them in place, but also to engage them, right, as captivated audience, so that we could really help them to think differently, also to help them transition into stable housing by the time they exit the program. And then, of course, this is a regional public health emergency response to be able to flatten the curve of the spread and to address the pandemic. And I also want to really emphasize that when we say medical vulnerable people, that we are looking at asymptomatic population. The next slide goes into the goals of the Project Room Key. I think I cover the first, the upper left-hand bullet in terms of preventing the spread. And also, this is the opportunity to keep our local businesses open and members of our community employed, because the master leased hotels, they're able to retain their motel staff. Then that means that we would have less people who would be furloughed or who would be unemployed. And then, of course, we want to be able to prevent the surge on our healthcare system by vulnerable people experiencing homelessness who would need hospitalization should they contract COVID-19. And then overall, we want to be able to protect our communities from the spread of this deadly and insidious disease. I think with that, my piece was really easy and simple, and I'd like to do a warm handoff to Jose.
Thank you, Ashley. For those of you who I've not had the pleasure of meeting, my name is Jose Delgado. I'm the Director of Government Affairs for LASA. As Ashley mentioned, the whole purpose behind Project Room Key is to ensure that those folks on our streets and in our shelters who are most susceptible and vulnerable to the effects of COVID-19 are given a place where they can quarantine and isolate themselves for the duration of the stay and for the duration of sort of the pandemic. As it was also covered, there's a lot of confusion around what Project Room Key is. this is for people who are not positive or symptomatic. So let me be very clear with that. These aren't folks who are being housed in these locations who arrive with any symptoms or being quarantined because they're COVID positive. In fact, these are folks who, before they even get to the site, are provided some sort of medical testing to ensure, like, some temperature checks and nursing to make sure that folks are arriving are not symptomatic or showing symptoms of COVID-19. As was also mentioned, these are folks who are 65 years of age or older, or who show some sort of chronic or underlying health condition, as indicated by the CDC and their specific guidelines. So specifically, these are folks who might come in with chronic lung disease, moderate to severe asthma, any types of serious heart conditions, folks who come in who are immunocompromised, who've gone through some sort of chemotherapy, and folks who might have diabetes, chronic kidney disease, and other types of diseases that might make them more prone to hospitalization, who are folks who are coming in and may add to the folks that need to be in intensive care units. So the whole purpose is to avoid occupying some of those beds and leaving those for the folks who really, really need it. Thank you for moving on to the next slide. So the question comes, like, who are the people assigned to project sites? Another point of clarification I want to make is that these sites are not walk-up facilities. So some of you may wonder, like, where are these sites? Where are the hotels? I like to see the addresses. We're being really intentional about what the locations are in order to ensure that if there's press around them, that people don't have the ability to just walk up to the site. That creates a lot of issues for folks who may or may not be, who may not fit the requirements, qualifications for Project Roomkey. So we're really using these sites as a referral for referrals only. And the way to get referred into the Project Roomkey sites, they must go through an assessment of our homeless service providers, folks who are healthcare providers for, like, community clinics, direct referrals through our law enforcement partners, or other providers who have the ability and knowledge of their health needs in order to enter the site. We want to make sure that folks who are being referred into the location don't require real sort of intensive care, which will create even more confusion at the site. So we want to make sure folks who can take care of themselves and carry on their daily functions without assistance. So these are the folks that we are targeting for Project Roomkey. Next slide, please. So as Ashley noted, the county, through the County Homeless Initiative team or County Real Estate team, and with the help of and leadership of our 5 Board of Supervisors, they partnered with the state to work directly in the negotiations and identifications of hotels across the county. So these are, the negotiation process could be sort of a lengthy one, but with the end goal of making sure that whatever sites identified are a good fit for our folks. The leases and time periods in which these lease agreements are made are for 90 days, which allows us enough time to be able to ramp up and fill those rooms contracted with our clients, with the expectation at the end of the 90 days that we help build an exit strategy or a housing plan for these. And I'll get more into that towards the end of the presentation. The way that we operate a site is that LASA helps procure a service provider in the area who's familiar with administering and running an interim housing location or an interim housing shelter location, who have the experience, who understand what the needs are and sort of ins and outs of the shelter. Once there, with the assistance of our partners at the LA County Fire, are expert at identifying pain points, making sure that security is taken care of. As was hopefully noted before, there's a 24-hour security on site. that is not only for the safety and security of the community where the location is sited, but also for our clients themselves. You want to make sure that folks feel secured in those locations. Finally, we have some awesome help from our county disaster service workers who've been providing a lot of supplemental assistance that our community service providers haven't been able to do. They've been a great help, either delivering meals for our folks once on site, and just helping with the daily intake and assessment of folks on site. One thing I forgot to mention is that our clients are served a meal, 3 meals a day, so breakfast, lunch, and dinner. That way we minimize the amount of ingresses, exits from the site for our clients. The idea, just like any of our community population, is to observe the quarantine and shelter in place rules that we've been implemented here in LA County. And so by providing folks with meals 3 times a day, and it lessens the amount of times that they would have to go out and seek food otherwise. Questions arise about whether or not folks can exit the location at any given time. It is not a lockdown facility. We cannot force someone to stay indoors to not allow them to exit. Folks are allowed to exit the location, but are strongly encouraged to observe all safety precautions, whether it's a mask. And folks are really asked to just exit the location only for necessary means, whether it's to go pick up medication at the local pharmacy or to go to some sort of medical appointment that they may have, or folks who are employed may be able to go out and do their normal 9 to 5. In order to enter and exit a location, you must go through a nurse check. So any individual that exits and wants to enter the location, including staff, including fire department folks, including our folks here at LASA, they must go through a nurse screening, which will register a temperature check just to make sure folks aren't exhibiting any symptoms or anything of that nature. For any reason that folks do start exhibiting symptoms, there are protocols in place which will allow us to quarantine an individual or person, and then make sure that we follow our DPH guidelines to make sure that that person is taken care of moving forward. Next slide, please. And I think I covered a little bit about this. So the staffing, this is just a slide that kind of outlines the staffing of each of our sites. You have folks from a fire department, service provider on site, LASA staff, county disaster service workers, a nursing staff, and a 24-hour security, just to make sure that folks are following rules and for the safety of everyone involved. Next slide, please. So up to date, we have over 3,100 rooms under contract that the county's managed to get into agreements with. This is an extraordinary number that we want to leverage moving forward. As the video stated, as the Supervisor Mercury Thomas stated, the amount of effort and work that we've managed over the last 4 to 6 weeks has been unimaginable. This has really been a Herculean effort to get this many people into housing, even if it's temporary. This is allowing us to work with folks one-on-one to really put together a strategy and a plan that towards the end of the program, folks have somewhere to go. Next slide, please. So this is sort of a very a key question that folks are curious to know more about, like what happens after the 90 days. The plan is never to just open doors up and have people just walk out of the site. As we like to say, this is not business as usual. We're really trying to take advantage of the 90 days that we have with folks to really get that case management involved. And so by the time the 90 days, or even sooner than that, we can get folks involved in some sort of discharge plan where they can safely arrive at a permanent housing solution that they're eligible for. So that's why our folks, our partners at the county, including Doc and Ivan, some of the folks on the call, along with our folks in philanthropy, we're all working together to figure out what the plan is, to really be thoughtful and not waste this opportunity to have this many people indoors, and to really either find all the resources that they're eligible for and currently not getting, whether SSI, whether it's Social Security, or even Veterans Administration resources that folks aren't receiving. This is our opportunity to really get them connected and plugged into those resources that will allow them after the 90 days to really find some stability in their lives. And part of the PRK program is to really, as you know, we have a number of congregate interim housing sites across the county. In order to really avoid having sort of outbreaks in those locations, we've really stressed and try to decompress those shelters and place some of those folks regionally in their corresponding sort of PRK sites. So at the end of this program, once we have sort of the slowdown of the pandemic and we've gotten the okay from the Department of Public Health and sort of our officials to go back and resume sort of our normal lives and some normalcy, if folks aren't haven't been identified for a permanent housing solution, there is an opportunity to return some of these folks back to congregate housing sites. So all this, again, it's in the midst of an emergency. We've been working tirelessly to set all these sites up with one goal in mind, which is to really prevent the spread of COVID-19 in the homeless population. Now, as we sort of hit week 5, week 6, we're now starting to think about what happens after. And so that sort of thoughtful and fruitful discussions that we're having and are ongoing, and are once we're ready to share a little bit more and have some of that planned out, we'll make sure to come back to folks here on the Zoom call to share that out. Next slide, and I believe the next slide is questions. So Ashley and I are here to answer any questions. I know that Ivan has been out to a couple of sites in his supervisory district, so he can give you sort of an on-the-ground perspective on how some of these sites are looking, and how they, from an outsider's perspective, what the operation is looking like. So with that, I'll stop there and see if I can answer any questions.
Perfect. I'll start with the first question. You just touched on it briefly there, Jose. So 90-day window, clearly the ideal scenario would be to get the people into permanent supportive housing by the end of that 90 days. In the event they don't, it sounds like they can possibly come back. So how are you guys looking at extended contracts with these hotels? And then the second part of that question would be, let's assume for now, kind of in a worst case scenario, that there is a dip, a second wave in the fall that coincides with flu season. Are you guys kind of strategically thinking out, in a tiered process for longer term relationships with these hotels and bringing more on in that time frame?
Yeah, I think that the 90-day window is giving us enough time to really think through some of those contingency plans. Obviously, not all of these hotels currently in place, which at this point are about 22, 23 sites across the county, haven't all started at the same time. So they've all started at different times. So this is sort of allowing us to really focus on the first group of motels that have been established and working with those folks to figure out a plan. Moving forward, as we start progressing through the 90 days and start cycling through some of these groups, we can start thinking more about what happens next. Obviously, any extension is something that I know that the county is thinking through, figuring out exactly, bringing in the right people to have those discussions. But certainly, I don't want to speak speak out of turn or speak for the county in terms of what happens with negotiations on extending existing sites or adding more sites. I certainly don't want to speak for the county on that end, but I know for a fact that where there are opportunities, where communities are sort of receptive and open to having these, and once, hopefully through the 90 days, folks can see that these aren't what people might expect them to be, and in fact, these are sort of really good solutions for communities. I think one of the things that we've noticed is that as we move forward through some of these sites, our placement and our referrals are to really be given sort of a regional approach and figuring out like where are these sites, talking to cities. If cities have identified sort of a group of folks that they think might qualify for Project Roomkey, while we can't necessarily carve out or earmark X amount of rooms for the particular city, our goal is to work with that community's homeless population and really focus on trying to get as many folks that may qualify or meet the requirements for Project Roomkey into those sites. So in a way, we're trying to alleviate unsheltered homelessness at these communities. So hopefully after the 90 days, that's very apparent to some of these.
Okay, and what can people like myself, Councilmember Montiero, at the municipal level, what can we do right now to help LASA and the Homeless Initiative find, potential partners in each of the municipalities? I think right now, last I heard, we had 3 or maybe 4 hotels in Spot 8. So how can we, assist in increasing that, or is that something that you really need to do on a one-on-one basis with the business?
Yeah, I think if I know that the county along with the state have been working really closely through a number of referrals of independent hotel owners and motel owners. Now, not to say that if you have a particular lead or a particular relationship with particular hotels, that's something that we'd be more than happy to. I can kind of take the lead on taking that information and kind of filtering that up through the county folks who are in charge of negotiating those contracts. Obviously, we want to be as efficient as possible, and so there are sort of size requirements that we're looking at to make sure that the sort of what's the word I'm looking for? The economies of scale work out pretty well. We want to make sure that we get as colloquially our best bang for our buck here. And so there are size requirements based on spa and need that we're looking at. So these are a number of requirements that we have, or that the county and the state have as they're negotiating some of these motel lease agreements. But if you have anyone in mind, or if you know for a fact that there's a particular motel or hotel that may be interested in participating, I'd be more than happy to kind of individually take those on myself and then filter those out to the county real estate team who's working on these deals.
Okay, great. All right, I see Janet Turner from Congressman Liu's office has her hand raised. Janet, you want to unmute yourself and go ahead and ask your question?
Yes. Hi, Jose. Nice to sort of see you in the dark.
Hey, Janet.
This is such a fabulous program. I am just so thrilled that this has come about. I mean, it's under terrible circumstances, but I'm really personally hopeful that this could be one step in working on fixing homelessness. And so my fingers are crossed on that. But of course, as you know, I always hear the problems. People are always calling me with the problems. And so I have a 57-year-old woman with asthma in Venice who says she's been told she's on the list, but has can't get any response on how long it will take to get her a room. Is this something I should send to like the county supervisor to handle?
As you can imagine, our need exceeds our capacity at the moment. So it's not to say, it's unclear where she is on the community queue in order to get her into these sites. As a councilman just mentioned, there's only about 3 sites currently in the Spot 8 region. And so again, our need certainly outsizes our capacity to house all the people that we'd like to. Again, I certainly not want to make any guarantees or be able to say that we can house her. But if she's been connected to a service provider, she's working with someone through our referral system, and then she's in the queue with everyone who's eligible. And as we continue to expand the portfolio of Project Roomkey sites, then we'll be able to expand the capacity to serve as many people as possible.
And one other problem that I got a call about is that a woman in San Pedro she thinks the hotel is called Sunset something. It's being run by the Salvation Army. It has leaks everywhere. The rug is incredibly filthy, and there's mold. Who would I report that to?
You mean there's a client who is who has
Who is in Project Room Key, called to say to me she was upset because there are leaks throughout the building, and the carpet is so incredibly filthy, it's black, and that there is mold everywhere. Now I know that probably 99% of your hotels, motels are fabulous, but looks like one snuck in. Who do I report that to? Her supervisor?
Yeah, I think we can take that back. Hi, Ivan, homeless deputy with Supervisor Hahn. But we can take that back. It's the Sunrise on
San Pedro.
In San Pedro. So we can take that back, and we'll work with LASA and the county to try and look at those issues. But thank you for raising them.
Thanks. Great job, though. Great work. Appreciate it.
Thanks, Janet. All right, Jesse.
All right. Hello, everybody. My name is Jesse Ramirez. Just a brief introduction. I'm the Hawthorne Homeless Services Coordinator. Started about a month ago. And I have been sending in some referrals for Project Room Key. First and foremost, I want to say thank you for the LASA team for facilitating this this program. It's a really great program. I'm very privileged to be part of this. So I did have 2 questions, and it's a bit twofold. One is I just wanted to get clarification on the 3 hotels. It's Lomita, it's Lawndale, and it's Sunrise Hotel in San Pedro. So the second question I had was, is there any negotiations on securing any rooms in the Hawthorne or Gardena area? And what are the specific size requirements for these motels or these hotels?
I cannot speak for the negotiations process. That's something that we're not necessarily part of. LASA just, once the county and the state have sort of made their agreements, we are made aware, and we're just given that information moving forward. The size requirements, I think we're looking at sites that are about 50 and above or 100 above. We're trying to really make, I'm not sure if Nathaniel's on the line here, but there you go.
Jose, if I can chime in. So sorry to introduce myself earlier. I was on another call at the same time as this one and didn't want to interrupt the conversation. I'm Nathaniel Vergara. I'm the interim chief program officer. I just logged in with the login that Jose had. That's why his name is showing up. So I apologize if it looks like I'm lurking in the dark, hiding. It's just the lighting in here. So as Jose said, the leasing process is being handled by this county and the state. So I don't have specific details about any hotels in Hawthorne, but I can say that we've provided feedback to the county that in terms of really getting the best bang for our buck in terms of provider staff, leveraging provider staff, the disaster service workers, and all of our contractors, including the nurses, et cetera. 100 plus really, 100 is kind of the minimum for the sweet spot. Below that, it's less cost effective. We have had some hotels as small as 50, but 100 is, it takes just as much work to get a 100-room site up and running as it does a 50-room site with twice the payoff. So we've asked the county to concentrate on the larger hotels.
And then if I could just add on, just to his point, because I was just on the phone with our real estate people, that is correct. 100 or above, primarily for the appropriate staff and funding. In some situations, we are looking for a little bit below 100, depending on the size of the motel or hotel.
And I don't know, I can't speak for the second district because the cities you just spoke to are in the second district, but I know in the fourth district, I know real estate in the county are looking at many hotels and motels from the beach to other parts of the South Bay. But I would talk to SD2 if you want specifics on those two cities.
Thanks, Simon. Okay, Alex, go ahead.
Hi, this is Alex, the Mayor Pro Tem for Hawthorne. Actually, to follow up on that question, can us, like, the city council people get the guidelines for if I want to approach a motel or hotel, what can I share with them to say, this is the guidelines and this is what they're looking for? So can we have something in writing that can be emailed to us?
Yeah, what I can do is we have a frequently asked questions sheet specifically for hotels and motels that we've accumulated over the past couple of weeks that we've seen to be common questions for folks. So I will make sure to send that to Grace and she'll forward it on to the group. All
right, thank you.
Jose, one other thing that would be good if you have, and I'm just speaking from an elected official perspective, is if you have any frequently asked questions or things that we can use to put out to residents, especially the ones who tend to get a bit NIMBY-ish when it comes to this project Roomkey, and it just gets a little bit ridiculous online. It'd be good to have kind of just a handful of things that we can just direct them to and really start clearing the air and some of the fear around why this is such an awful program. So,
as a matter of fact, we do have frequently asked questions for hotels, motels, elected officials like yourself, and for general constituents. So all three are slightly tweaked, but all come out with this sort of general message and questions and answers around some of the things that we've seen over the last couple of weeks. So I'll make sure to send all three to Grace.
That'd be perfect. Yeah, send it to Grace, and then Grace can get it out to everybody on the task force list. Okay, are there any other questions for Ashley or Jose or Nathaniel?
I'm happy to do.
Grace, was that you? All right.
No, I was just earlier saying that I'm happy to send the sheets, and then
Grace, you're cutting out.
Everyone should have gotten a copy that was provided to us. Then I'll just mute.
Grace, unfortunately, your connection's not too good, and so we're only catching like every fifth word.
We'll get everything. We'll get everything posted to the website.
Yeah, I would just, if you have comments while your connection's bad, put them into the chat area, and then people can read them. And then if your connection gets better, then we'll try it again. All right. I see Councilmember. Yes.
Hi, just if I could just provide two additional comments really quickly.
Please
I just want to add that as part of the Project Roomkey staffing, I want you to know that we also have roving behavioral health clinicians providing clinical services. And again, they're either roving or via telehealth. And they will also be pairing with the substance use disorder clinicians as well. Just wanted to also provide that. That's really going to amplify healthcare services on site. And then secondly, I also wanted to share with our group here that these are our homeless neighbors who are already in SPA 8. So it's not like where we're going to get our people experiencing homelessness from different spas. Just also wanted to provide that reassurance that we're already serving them and they're already in our jurisdictions. That's all. Thank you.
No, perfect. Thank you. And listen, kudos to you guys and to LASA county supervisors and the state for really rolling this program out. I think it's awesome, and it's amazing how fast we can innovate in the midst of a crisis to do things that we've been trying to work on for multiple years now already. So hats off to everybody for really making things happen as quickly as they have. I just want to recognize Councilmember Armato from Hermosa Beach has joined the meeting. Welcome, Stacy. All right. If there are no further questions related to Project Room Key, then we will move on. Thank you again, Ashley and Jose for presenting and taking time out of your day to be here.
Thank you very much, everyone.
Okay, next on our agenda is an update of PATH services. So Courtney and Hallie.
Hi, everybody. It's Haley from PATH. Unfortunately, Courtney is at our quarantine site, so she's unable to give the presentation tonight, this afternoon. Okay, you can go to the, do I have power? Okay. Our team is still intact, doing some intensive street case management. We're not doing screenings in CES right now. We still are housing and we still are giving supportive services. When all of this happened in early March, our first thing that we did was go out and educate. So we handed out flyers about the symptoms. We were giving out cleaning supplies, and we were then following up about their symptoms to make sure that they were completely informed about how COVID looked in their communities. The next thing that we did when the masks and gloves started coming in from our Department of Health Services, then we started handing out those. So for about probably 2 to 3 weeks, we were disaster social workers going out and informing and making sure that everybody was safe, everybody understood the virus, and everybody understood what was going on, that things were shutting down and businesses were closing, how to get food and things like that. Next slide. We have tried our very best to keep to our steady schedule. It might not be a full day, it might just be touching on case management, but we're still hitting all of our cities. Next. Same thing, again, the teams have kind of rotated. We're still hitting all of our cities, just probably not as long as we normally are. Next. And again, next. LA HOP. So we were continuing to answer our LA HOPs until about a week ago, where LASA as well as DHS said we need to kind of put those on hold unless they were Project Room Key referrals. So with the help of Brianna and Jasmine at Harbor Interfaith, as well as our team, we are still looking and answering them. They just might be a little bit delayed, and we are answering them immediately if they require the Project Room Key referrals or any kind of medical care. Next. As you can see, the numbers are down, and I think that's because a lot of city staff and neighbors are inside, not necessarily on the streets. Torrance still remains high, and so we are steadily in Torrance, and we are again trying to do a lot of Project Room Keys for all of our residents. Next. Looking at the numbers, during this time period, we are not going to necessarily have a lot of referrals. However, we are getting creative. As I think Ashley and Jose said, most of the mental health clinics are doing telecare. And so we are trying to get our participants that don't have phones so that they can call their mental health provider. We are still linking to substance use. Detox and residential are still open. In fact, there's a lot of beds right now. And so we have been able to connect. However, everything is just going a little bit slower because the intakes now require all kinds of COVID screening. Primary care, the nurses with MHS, as well as with DHS, are going to be coming out soon for testing in the streets to make sure that everybody is served. For benefits, the Department of Social Services was closed probably for 2 to 3 weeks. However, we can contact them again on the phone and get people signed up. It takes about a week now to get your card, requiring a mailing address. So we're now letting a lot of participants use our office address if needed. Interim housing is slow going because a lot of people have had to reduce their beds because you do have to keep to the social distancing inside. So we are using the rec centers when people need to go inside. and we are communicating with our local interim housing in case they need to decompress. And again, those individuals that needed to decompress went into the rec centers or the quarantine sites. Again, we're not really doing CES assessments right now, and we are still housing. It is another very slow process, but what we're doing right now is PATH staff are going to the apartments, videoing them or FaceTiming with the individuals to make sure that they can see the site and make sure that they can meet the landlord, and then they can sign things. We had to keep to some extra sanitizing practices with the lease signing and with meeting with participants, but we're still doing it. It's just, again, going pretty slowly, but we are still housing. Next. As you can see, this was our COVID response. The first thing that we did, again, was we went out and we started informing people. We made hygiene kits, and everybody started to employ what we called stop, knock, and drop. So instead of going into large encampments because it wasn't necessarily safe at that time, we were just calling out that we were leaving something outside of their tent. We were asking them how they felt, but we were still keeping the 6 feet. We serve a lot of the meal programs, especially in Redondo Beach, so we had to talk to them to see how they were going to keep safe and how the food distribution was going to stay safe. We are still taking referrals and we're still going there. But as you know, everything has changed. So it's brown bags instead of sit down. Again, everyone has masks and gloves. And we are trying our very best to keep the 6 feet wherever we go. Next. That's us at the quarantine site. So originally we were asked to man the quarantine site because it was in El Segundo. It was at the Dockweiler Park. All of the participants were in their own RV, and we were just going and handing out food and everything like that. However, the RVs proved a little bit challenging for our participants to manage. They're not as easy as just turning on the light and being in a hotel room. So about maybe 2 weeks in, it was then moved. However, the team members that you see there, that's Courtney and Jasmine and Damien and also Brittany, they are working there part-time at the quarantine site. The quarantine site means that people are positive or have been exposed. They're there for probably a maximum of 17 days. It is mainly run by nurses, and we are there for discharge plans. We are seeing people all over the county, and we're working with the rec centers and Project Room Key because once they leave, they're medically cleared. And mainly what we're doing there are intakes, explaining why they're there, how long they're going to be there, working with the nurses for their medical plans, and then discharging them either to rec centers or Project Room Key. Next. If you have any questions, let me know. We are also running the Lawndale Project Room Key. It is our rapid rehousing manager and also our permanent supportive housing director that are manning that site. Right now, let me see, checking mine. I believe there's 97 total rooms. There has not been any police activity, and they are accepting referrals again from LASA. It's like a mini CES with our Spot 8 outreach teams and community members, putting them on the list. LASA tells us who can go in, and then they're intaked. And again, the main plan again is to get case management or to link them to their current case manager so that they can leave and be permanently housed. And that's it.
All right, great. Thanks, Haley.
Mm-hmm.
Any questions for Haley? All right, I'm not seeing any, so thank you once again. And we will move on to item 6 and Brianna for an update of CES activities. You just got to unmute yourself and then it'll be awesome.
There we go.
There you go.
This is Brianna with Harbor Interfaith Services. I am the regional coordinator for the adult coordinated entry system, and so but I have updates for all 3 systems. And then Sherry Weaver is also on the line, and she'll give an update on the San Pedro interim housing site as well. once I'm finished doing my updates. So at the last meeting, we had announced that we were going to be doing a housing and health fair in Gardena in April. However, due to lovely COVID-19, we had to postpone, and so if permissible in the future, we'll reschedule, but all events like that have been placed on hold. We continue to conduct business pretty much as usual, obviously following all of the safety guidelines as it relates to social distancing, masks and gloves for our staff who might be in the field. Our outreach team in the beach cities is still conducting outreach, much like the past team, providing education, providing information about various different shelter opportunities. And then they've also been able, through some really hard work, to place about 45 individuals either in shelter or in Project Room Key sites throughout SPA 8. And so I'm really proud of that work. Our rapid rehousing program is busy, of course, with referrals from Project Room Key sites and other shelter sites. And so they are staying quite busy. Prevention in all three systems has slowed down some as it relates to financial assistance because of all of the different rule changes as it relates to eviction proceedings in the state of California and the county and city of LA. And so a lot of the work that we've been doing, if we have been getting clients who may have an eviction notice of some kind, is making sure that they get referred to the appropriate legal services so that they are following the different rules. We're not experts, but we do get wonderful updates from our legal aid partners in SPA 8 at the Legal Aid Foundation of Los Angeles so that we're able to, at the very least, direct clients in the appropriate direction. So that's the majority of the work that we've been doing as it relates to eviction prevention around folks who've lost income related to COVID-19 and become behind on their rent. We are also a Project Room Key provider. We are the provider at the Lomita site, and we have 59 individuals currently enrolled at the site, and the majority of them are 65 and older. We do have some that are younger who have the other pre-existing conditions that are listed, but a majority of ours are seniors, and as Healy mentioned, working with them to stay connected with the providers that referred them so that they have ongoing case management or referring them to appropriate resources and to ensure that there's an appropriate exit plan. So we're not a quarantine site, we're the Tier 1 Project Room Key site in SPA 8. So we are working with the high-risk population, those like that was mentioned in the Project Room Key presentation that are 65 and older who have pre-existing conditions. And so very much what Jose and Ashley and Nathaniel spoke about in terms of the process. Yes, the nursing staff is there to assist us. There are protocols in place, there's rules, and the case managers are there to ensure that everybody's day-to-day goes smoothly. We also have the disaster service workers from the various county agencies, along with LA County Fire and lifeguards, who've been incredible support in terms of the day-to-day meal deliveries and assisting with shipments of meals, things like that. So that's been wonderful partnership. We've learned a lot from one another, so we're super thankful for that. In terms of goal attainment, we've also seen some slowdown and we've had to get creative, much like past, in terms of viewing apartments with clients, units that are available, going out and taking videos and sending them to clients, seeing if it's something they're interested in or if they're capable and willing and want to go on their own and the manager's doing in-person viewings, they can do that. We're just limiting the amount of face-to-face interaction. We're also available, we are allowed to do some paperwork over the phone, so getting not necessarily wet signatures from clients on different documents so that doesn't slow the process down. We are able to do a lot of that either via email if they have access or via the phone. So that's allowed things to continue to move forward for folks enrolled in various housing programs. We've been working with the Housing Authority, particularly in the city of LA, and they've moved everything online. That's been incredible. So we've seen folks still get housed with Section 8. That process still moved forward through the interview, through the issuance, and now we're kind of starting to see where the housing search goes from there with those with certificates. So it's been interesting because everybody, including our clients, have had to kind of change the way in which we operate and what we're used to being able to just go to the DMV and get an ID and trying to be creative and think outside the box. So That part has been a challenge, but also, again, allowed us to team up with our partners and come up with really great solutions. In terms of goal attainment for CES individuals for July 1st of 2019 through the end of April, we've assessed 401 individuals in the adult system spa-wide. We've also housed 54 folks in rapid rehousing with a 92% retention rate. And then we placed 57 formerly chronically homeless individuals in permanent housing. And then we've also assisted 40 households through prevention in the CES adult system. In our youth system, we've assessed 100 new youth this fiscal year. We've housed 35 youth in our rapid rehousing program, and we have 100% retention for the youth in rapid rehousing. And we've been able to assist 8 youth in prevention to retain their housing when they were at risk of losing. And then we've also, in the family system, we've assessed 383 families with minor children. We've housed 202 families through family rapid rehousing with a 95% retention rate. And we've also assisted 65 families spa-wide in maintaining their housing through prevention. So still doing all of those programs. All of those programs are still moving forward, and that's where we're at year to date. Our end of fiscal year is the end of June, and we're on track to meet all of our outcomes through the coordinated entry system. With that, I'm going to toss it over to Sherry Weaver to give an update on our San Pedro interim housing site.
Hi, can everybody hear me? Hi, can you hear me? Hello?
Yeah, we can hear you, Sherry.
Yes, we're just all on mute.
Okay, thank you. So I just want to report out on our interim housing site here in San Pedro. Back in late January, Supervisor Hahn took an unprecedented step and took a unused county facility, the LA County Healthcare Center over here in San Pedro, and repurposed it. It's a 14,000 square foot facility. We were able to open on March the 2nd, and we're providing housing for 40 single adults, 21 of which are men, 19 are women. And our primary focus, if you've ever been down to the San Pedro Post Office, it's probably one of our largest encampments in the area. So we are targeting folks that are in encampments in and around that area. We are currently full. In addition to the single adults that we have here, this is a pet-friendly facility. We currently have 6 dogs that are living here with their owners. And the other nice thing about this facility too is that we are also in a partnership with Harbor Community Clinic, which was actually on site just downstairs from this project. So they went from being a federally qualified health clinic that was serving pediatrics to now they are primarily serving our residents or single adults experiencing homelessness at their clinic. So some of the things that our residents are able to obtain are TB tests, health screenings, behavioral health services, referrals to healthcare specialists as needed. And in the very near future, as things begin to open back up again, they'll also be able to provide dental services and eye care services through their clinic. So we are really blessed to have, those services like literally right here on site. Do want to report that so far to date, we have 1 permanent housing placement. We have 1 that has a HACLA voucher that is completing the inspection process, and I think as both Haley and Brianna lifted up, those inspection processes have, become quite a bit more time. So typically what would take 2 weeks is now taking on a 30-plus day process, where the owner themselves is actually signing an affidavit and providing photographs of their unit to the housing authority. And at that point, then the housing authority does their final negotiation. We've also had the opportunity to match 4 of our residents here, actually 3 of which are couples, and 1 single female to existing HACLA vouchers that we have available. We are working with, we have 2 individuals here that are youth. They are 19 years old. One is a former foster youth, and the other one, we're working on an independent living program. So those are 2 that we're working on. a lot of our challenges right now really are tied to the DMV and the Social Security office being closed. So, you know, the requirement of some of these documents are, we can't obtain them at this place. But, you know, that's one of the challenges we're facing. On the upside, we've got almost 87% of our residents here were able to apply for, with the assistance of the staff, for their stimulus checks. Quite a few of them already have their payments coming through. And I think that is it right now. Any questions?
Any questions for Shari or Brianna? All right. Well, thank you guys for everything. Okay, we will move on then to Supervisor District 2 and 4 updates. Why don't we start with Nicole and her team for SD2.
Hi, Christian. This is Dakshika actually. So I will start from
Okay,
SD2.
perfect.
I'm Supervisor Ridley Thomas's senior homeless deputy, and then Nicole will add and talk about a particular project. But nice to be here. Thank you. I understand earlier on in the agenda, you got a good briefing on the county's Project Roomkey. But I want to stick to the post-pandemic housing response, which I'm sure people referenced. So the supervisor led a motion on April 14th, and the co-author was Supervisor Hahn. So we had a nice South Bay Cities representation there on the authors of that motion. The motion really looks at two things. One, it is a follow-up motion to a motion the supervisor did in January, on January 21st, to really look at the governor's task force work. I don't know if people know about the governor's task force. The supervisor co-chaired that task force with Mayor Steinberg of Sacramento. What came out of that task force was a report called the Comprehensive Crisis Response Strategy, to really look at how you could get more people off the streets, build housing faster, and connect more people to mental health and substance use treatment. So January 21st, the supervisor did a motion to see how the county could look at that report and see what we could implement locally. Based on that motion, March 24th, the county did a report back saying that the county wanted to explore a commitment to provide housing and services to anyone experiencing homelessness who was aged 65 years or older. Now, remember, this was before COVID-19. But then, as you know, with COVID-19, FEMA is asking us and CDC is asking us to concentrate on really bringing inside that same group, that elderly homeless population that's 65 years and older. That is an actual FEMA criteria, which is why you heard from Harbor Interfaith and PATH, so many of their folks are older homeless folks. So the April 14th motion is asking the county to report back in multiple waves to look at everybody that has been brought in through Project Roomkey or other interventions due to COVID-19, and really think about the long-term housing plans for people aged 65 plus. That first report back on that is due May 14th. So that first report back is coming next week around what the county has found out based on the demographic analysis of people that have been brought inside, and what types of long-term housing options will be needed to make sure that they have a sustainable long-term housing plan once COVID-19 subsides. So that's one piece on the April 14th motion. And I think Grace sent the motion around to the folks on the call. If not, I can send it around so people can see it. The second piece from the April 14th motion is again following up on the comprehensive crisis response strategy and looking at holistically and comprehensively what the county can do to say that if you are 65 years and older and you are on the street experiencing homelessness, what do we have to do to fund a comprehensive strategy so that we can commit to providing housing and services so nobody who is 65 years and older has to be on the street. So that is a more long-term plan. But I just wanted to let the folks on this call know that those are the two things that we are hoping will develop from this motion, the short-term and long-term housing options for people 65 plus. So that's the April 14th motion. I will add that there's a new motion, which you will see on the board agenda for next Tuesday, which looks at long-term housing plans. Supervisor Kuehl is the lead on that, and Supervisor Ridley Thomas is the co-author. That is for folks who are below the age of 65. So looking at long-term housing plans for people who are not older adults. So both these motions, the April 14th motion that I just mentioned, and then the one that's coming, yet to be approved, but I would assume it will get approved on Tuesday, are looking at kind of the post-pandemic housing response and long-term housing strategies. It will look at existing resources within the county and the county region. It will look at state resources, but I see Jeanette and Janet are coming up next. There will be a close interaction with federal advocacy and federal resources that are coming down the line. So there is an opportunity for the South Bay Cities COG around advocacy on all these pieces. So we will make sure we stay in close touch and let you know what those advocacy requests might look like. And I can take questions now on that piece, or I can move to Nicole, and then we can take questions on both my piece and Nicole's piece, however you want to do it.
Doesn't matter. Any questions right now? All right, why don't we go to Nicole, and then if anything pops up, we'll
Great.
open it up at that.
Hi, everyone. I'm Nicole Powell, Assistant Deputy for Homeless Advocacy with Supervisor Ridley Thomas's office. So a South Bay update is that on March 23rd, the supervisor launched a shower program site at St. Margaret's Center in Lenox. And this program offers showers through the Shower of Hope, along with advocacy, counseling services, immigration services, grocery distribution, utility assistance that St. Margaret's Center provides for the South Bay community. And this shower site at St. Margaret's Center is one of a larger network of shower programs funded by Supervisor Ridley Thomas, part of a program called Hospitality Hubs. And Hospitality Hubs work in conjunction with faith-based organizations to provide hot showers, meals, groceries, gently used clothing donations, clean underwear, and the loving community of a congregation to people experiencing homelessness. And it also just adds another hand washing and shower resource to people experiencing homelessness who might not have access to those resources. And we have currently 5 sites in the 2nd District, with a 6th site expected to open in South Los Angeles towards the end of this month.
Is that it?
Yes, thank you.
Okay, great. So one last time, I'll ask any questions for our representatives from District 2.
Okay,
yeah,
Christian, I don't have no question, but I'm glad to hear about that the St. Margaret Center shower. I think that's very good for our community because we, connected to Lenox anyway. But I have to run because I have a special city council meeting at 4:30. So I'll see you guys in July 1st.
All right, see you soon.
Stay safe.
Take care.
All right.
Okay, so then thank you guys for being here with us today, and we'll move on to bring back Ivan, and want to talk about District 4.
Well, I think everything has been said.
Okay.
We talked about the joint motion, as we talked about Project Room Key, which we are pushing and supporting throughout our district in Lomita, Long Beach, San Pedro, and then looking to other sites in the South Bay. Great work at our San Pedro shelter that the supervisor spearheaded with our great provider, Harbor Interfaith. We are looking to potentially bring back our shower program in partnership with Pastor Lisa. We're going to be talking to her and seeing how we can bring that resource back to the South Bay. But we're just diligently working to make sure we can address the homeless population in the South Bay during this crisis. And so, yeah, I have nothing else to say because everything already has been said.
Okay, so I'll just put it out there. Are there any questions for Ivan? All right, then let's move on for a legislative update from Janet Turner, who spoke earlier from Congressman Liu's office, and then we also have Jeanette Christian from Senator Feinstein's office. So Janet, you want to go first?
Thank you so much. Hi, everyone. Nice to see you, even though it's virtually. It's great that we can still get together, and I appreciate these wonderful updates that you give. Thanks so much for that. So, yeah, first of all, I just want to remind everyone that Congressman Liu is a member of the Congressional Homeless Caucus. So he takes homelessness very, very seriously. Wanted to let you know that the CARES Act does address homelessness in a few ways. It provides emergency homeless assistance grants, provides rental assistance to those in need. There's a 4-month moratorium on eviction and foreclosures on certain properties. And it provides funding to state and local governments to fund a broad array of community needs. The CARES Act also helps homeless veterans. It gives the VA more authority to enhance health and housing initiatives for homeless veterans, including increased telehealth and case management, as well as homeless support services for veterans. And $360 million was given to invest in programs to provide training and supportive services for homeless veterans for their future. So just very briefly on some of the legislation, the congressman got an amendment to the National Defense Authorization Act passed and signed. Woohoo! Quite an accomplishment. And this established a process to modify the West LA National Guard Armory to allow it to become a new homeless shelter, which the county is going to be running and building, et cetera, et cetera. So that was kind of exciting. Don't want to ruin all of Jeanette's thunder. I'm sure she's going to mention HR 1978 that that Senator Feinstein and the Congressman authored together, which would provide $750 million in grants to cities each year. And there's actually 18 other bills on homelessness that he has sponsored, supported, or introduced. It's become a very important issue for him. And he will be introducing soon the Prevent Evictions Act, which I understand there is a Senate companion to as well. So maybe Jeanette has more. That's it from us. And of course, our office, even though we're working remotely, you can still call, and it will be directed to our individual cell phones. So that's all for me. Thanks so much.
All right, thanks, Janet. Jeanette?
Hi, Jeanette with Senator Feinstein's office. Good afternoon. I hope you're all safe and healthy. Thanks for letting me give a brief update. Janet did talk a lot about some of the issues, but just so you know, the Senate did return to session on Monday. There are still a lot of moving parts, so some scheduling and committees and votes are still being worked out. Our state and DC offices have been teleworking for the past 2 months, so our office operations like casework and meetings have remained as normal as can be. I'm sure you guys want to know about the next package. What I can say is that we know that both Republicans and Democrats say there will be another package. Specifically about homelessness, in the last CARES Act, as you know, there's $4 billion approved by McKinney-Vento emergency services grants. And those allocations through ESG are coming in different waves and different tranches. So the first, I don't have to go too wonky into detail about how much LA County and the cities are getting, but the first tranche is about $1 billion. And we know that some of the formulas for funding are still being worked out by HUD. So the senator did send a letter supporting the LA County's request for fair distribution of homeless service assistance grants, so to make sure that we get the fair allocations in California. Another action the senator has taken is asking congressional leadership, as always, to fund more resources for more programs, ESG, rental assistance, CDBG, and working with congressional leadership as they continue to negotiate these next relief package bills. One thing we've also done is co-sponsored legislation at $75 billion for a housing assistance fund. And so this fund would create a state housing finance agency and give them more flexible resources for federal aid with housing payments and helping people remain in their homes, helping prevent homelessness. I know that's been a big ask as well. So in the next relief package, which is still being drafted, as I've mentioned, we do expect to be pushing for significant funding for homeless assistance programs, rental assistance, the vouchers, push for more flexibility, more for SNAP benefits. So this is all obviously the intersections of housing and homelessness. So we were in a housing crisis before, and definitely don't want to worsen it with this pandemic. So we're trying to support as much as we can local and state governments and give them the flexibility to be of assistance. So if there's anything else, I can go into more detail on some bills, but I think just a general overview of what we're working on would be helpful. We have a lot of resources on our information page, and I've been sending out some weekly updates. So if you're interested, email me and I can add you to that. And I think that's it.
Okay, great. Any questions for Janet or Jeanette? All right. Well, seeing none, thank you both for joining us today and giving us that update. And if you want to send any links to the site you mentioned, just send that over to Grace, and then she can get that out with kind of a follow-up information from this meeting today. All right. So our last item of the day is an update of the COG's Homeless Service Coordination. So Grace and Jackie, this is you guys.
Woohoo! Okay, so can everyone hear me better now?
You sound crystal clear.
All right, so I went and got my iPad. So while you see me from my computer, I'm talking through my iPad. So
wonders of technology.
Yeah, I know. And then I got my phone going. I think I got everything here that I possibly could have technology-wise. Anyway, I wanted to talk a little bit about the hygiene funding opportunities, because I did send out information. Actually, Jackie sent it out to all the city managers, and we've been talking about it with our steering committee and board. And also I've sent information out to all of my contacts at the cities. But there's been some newer information, and so I wanted to share that. But just a little history. The county came to all of the COGs not too long ago, indicating that there's about $400,000 of state emergency funding that's available to the COGs. And then the amount that each COG is receiving is based on the 2019 homeless count. And so based on that, we had an 11.6% of the total count, or just under 1,500 people in our area. And then so our share of the funds equals roughly $46,318. And what we did, Lori Jacobs and I went through and looked at all of our cities and their point in time homeless count. And then we identified percentage-wise of that $46,000 what each city could access for some of these different hygiene opportunities. And what it is, it's a reimbursement program. So after a city decides what they're going to be doing, and some of our cities already have, they'll send invoices to the COG. It's kind of a pass-through. We send them to the county for reimbursement. So keep in mind, it's a reimbursement program. So some of the items that are available are portable hand washing stations. And back in the week of March 23rd, a number of hand washing stations were deployed by the county and LAHSA throughout SPA 8. And I believe we have 19 that were deployed in our area. Because I know a couple weeks ago when you get a little tired of being at home all the time, I decided to take a little field trip and drove around and tried to identify where some of them were. So hand washing stations are available to supplement what the county has already put out there. Also portable toilets, portable showers, and then also staff time associated with expanding hours of a restroom or in a park having the restroom or a shower open in a park. Some of our parks are closed, but a lot of them are open. So if there's staff time associated with staffing those park restrooms, then money is available for that. And then also in conjunction with that is the purchase of toilet paper, paper towels, soap, hand sanitizer, anything that complies with the CDC's recommended percentage of alcohol content for purposes of expanding the available hours of public restroom or shower facilities. Then also that money can be used for incentives for private businesses to allow persons experiencing homelessness to use their facilities as well. And then the other thing that I'm really excited about is that hygiene kits are available. So our cities can put together hygiene kits to have and be reimbursed for those to have them available for individuals in their cities that are experiencing homelessness. And the hygiene kits can include soap, washcloth, and thanks to John LaRock, we've identified no rinse bathing sheets. And so the county has allowed that expense. Hand sanitizers, masks, those are all things that can be put into one of the hygiene kits. And so right now, as I mentioned, we went back and identified our really kind of our top 6 cities based on their homelessness count, and then determined the amount of money that they would have access to them. I do know, well, Hawthorne and Torrance have moved forward in securing hand washing stations. So Hawthorne right now has 5 that have been placed at 3 Hawthorne parks. And that includes Jim Thorpe Park, 2 at Memorial Park, Eucalyptus Park, and Eucalyptus Park Skate Plaza. I can't even read. And then these hand washing stations will be, the distributing company is going to take care of them twice a week to re-up all of their supplies. And then also what I really think is smart that Hawthorne did is they put a flyer with information on how to access housing and food services on each of the hand washing stations. So I think that's a really smart idea. And then my understanding from Torrance, and I think Connor is still on the line, is that Torrance is working with a provider to get hand washing stations as well. They've rented 5 and they have another 3 that are pending. So I just wanted to share, and I've heard back from most of our cities, but there are still, so if there are other cities that want to be able to access the hygiene money, please let me know by Friday, because I've spoken with Redondo Beach, I've spoken with Inglewood, I've reached out to Carson, have not heard back. So I really need to get information back from you, because if we have cities that aren't interested in accessing this money that has been identified for them, then that means we will have more money going back into the pot. And so we can therefore spread it out amongst some of our other cities as well. So does anyone have any questions? Okay. Oh, I see a hand. I see Jesse's hand.
Jesse.
Hi. Hey, Grace. I was curious. The hygiene kits, is that part of the hand washing fund, or is that a separate fund?
That is part of the hand washing fund.
Okay. Thank you for the clarification.
Yep. So that was new since we originally spoke, because we just got clarification from the county earlier this week that hand washing station, or that the hygiene kits would be an acceptable use of the hygiene funds.
All right. Any other questions for Grace? All right, Jackie, did you have anything that you wanted to add, or?
Not really. We're meeting with a lot of different department heads and different Zoom meetings to share lessons learned and discussing some of these issues at those meetings. But other than that, I have nothing.
Okay. Fantastic. Well, thanks, Grace. All right, so next steps and follow-up actions. Grace, is there any next steps that we should be aware of before we go into our July meeting, or did you pretty much cover it all?
I think at this point, we've covered it. As Ashley mentioned, we're working on the innovation funds, so the majority of those funds are looking at region-wide programs. I know that one of the areas that we're really wanting to explore is home sharing. But of course, with COVID-19, that kind of has put things on the back burner. But I know Lori has been doing some research on that and has reached out and actually spoke with some home sharing programs today to kind of get their take on what they're doing in light of COVID-19. So we're moving forward with that. So as soon as this whole COVID-19 thing is lifted and we can get back to whatever the new normal is, then we'll be ready to move forward.
All right, fantastic. Well, then with that said, thank you everybody for participating today. If there is any information that came out during the course of the meeting, Grace will send a follow-up email with links and/or attachments so that you have those resources and you can take them back to your city. And then with that said, we will adjourn until July 1st, 2020. I don't know if it'll be virtual or if we'll be at our new COG offices, but you'll find out soon enough. So everybody stay safe, and thank you very much for participating today.
Thank you.